Hi, welcome back. Today I'm talking about should you ice or should you use heat for your knee pain? And the simple answer is both. You should do both. We're often told to ice for knee pain. Sometimes that works, sometimes it doesn't. Other people believe that you should only use heat for pain, and sometimes that works and sometimes that doesn't. So I'm going to talk about instances where icing your knee will be good and instances where heating your knee will be good. So let's talk about ice first. When should I ice for knee pain? When you have a new injury, when the knee is hot and swollen, and after a workout. Those are the 3 times that really work best for ice for knee pain. So how does ice work to get rid of knee pain? Ice works to get rid of knee pain by controlling and cooling it off, controlling the inflammation and cooling it off, restricting blood flow. Therefore, it controls that inflammatory process. This is why using ice for a new injury is really helpful. Icing a new injury will reduce swelling and decrease pain. If you have a hot and swollen knee from a new injury, ice will be your friend. So we want to draw out some of that heat from the joint and decrease the warmth and swelling, not smelling, sorry guys. Using ice on a hot joint will decrease the swelling and pain. If you've had a hard workout, ice is a good thing to do immediately after the workout. Icing your knee after a workout calms down any inflammation and can prevent pain from setting in. So how long should you use ice on your knee? I recommend 20 to 30 minutes at a time. How many times a day should you ice? Ice an injury as often as you can. Leave the ice on for 20 minutes at a time and then take it off for at least 20 minutes at a time before you put it back on. For a new injury, I like to ice at least 5 times a day. Okay, so when should you use heat for pain? To warm up muscles, to warm up a stiff joint before a workout, and if you have a Baker's cyst at the back of your knee. So heat helps improve circulation and warm up your system. This is why using heat before a workout on a cold, stiff joint or muscles works really well. If you wake up in the morning with stiff knees, use heat first thing. You can either use a heating pad, a microwavable heating pad, or just hop in the shower. One particular diagnosis or injury that tends to have a good reaction to heat is a Baker's cyst. So a Baker's cyst is a fluid-filled sac at the back of your knee. This cyst can swell up and limit your knee motion, and it can be really painful. Using heat on a Baker's cyst helps decrease the swelling by increasing the circulation in the area, and then the fluid in the cyst is drawn out into the bloodstream and therefore reducing the size of your cyst. So how long should you use heat for? Using a heating pad or a microwavable heating pad on your knee should be done for 20 to 30 minutes at a time. How often should you heat your knee? Heat your knee as often as you need to. And how often should you heat your knee for stiff joints? Heat your knee every morning, especially using a hot shower if you wake up in the morning and your knees are tight and stiff. I get this question a lot of, is it bad to use a heating pad for more than 30 minutes? Yes, it can be bad to use a heating pad for more than 30 minutes. The longer you use a heating pad for, the chances increase of creating a burn. So always use a heating pad while you're awake and make sure the skin that you have the heating pad on, that you can feel that area. Because if it's numbed up from either an old injury, a scar, something like that, then you might not be able to feel if the heating pad's too hot and you can burn your skin. Okay, so that's ice packs and heating pads for knee pain. Ice is great for a new injury when the knee is hot and swollen and after a hard workout. Heating pads are helpful to warm up stiff joints and muscles in the morning and before a workout, and for Baker's cysts. For more tips and tricks about knee pain, follow along.